Welcome to Lesson 19, the cardiovascular system. This lesson will explore the heart and blood vessels, common cardiovascular disorders, aging changes, risk factors, QMA responsibilities, and medication classifications used to manage these conditions. By the end of this lesson, you'll be able to describe how the cardiovascular system functions, identify key disorders and their symptoms, understand the importance of aging-related changes, and describe the QMA's role in care. The cardiovascular system delivers oxygen and nutrients to tissues and removes waste. It is controlled by the autonomic nervous system and consists of the heart and a network of blood vessels forming a closed-loop system. The heart is a four-chambered organ. The right side pumps blood to the lungs, and the left side pumps to the body. The pulse reflects how often the heart beats per minute. The blood pressure measures the force of circulating blood on the artery walls. Arteries carry oxygenated blood to the body. Veins bring deoxygenated blood back. Capillaries allow exchange of gases and nutrients. Blood contains plasma, red and white blood cells, and platelets essential for oxygen transportation, defense, and clotting. Cardiovascular risks increase with age, especially in men. Smoking, poor diet, and sedentary lifestyle also contribute. People with diabetes or a family history of heart disease are at even higher risk. Reduced blood flow to the heart muscles cause ischemia and angina. A complete blockage causes a heart attack or a myocardial infarction. Symptoms include chest pressure, radiating pain to the arm or jaw, shortness of breath, and nausea. CHF occurs when the heart muscle is too weak or stiff to pump blood. Fluid builds up in the lungs and extremities. Signs include swelling in the legs, fatigue, and difficulty breathing. Arrhythmias are abnormal heart rhythms. They can be too slow, known as bradycardia, too fast, known as tachycardia, or irregular, known as fibrillation. Some are harmless, others can cause stroke or cardiac arrest. A stroke happens when blood flow to the brain is blocked or a vessel ruptures. A TIA is a temporary blockage. Signs and symptoms include numbness, vision loss, confusion, difficulty speaking or walking. Hypertension causes damage to vessels over time and increases stroke and heart failure risk. Atherosclerosis is plaque buildup that narrows arteries and limits oxygen delivery. With aging, the heart pumps less efficiently. Blood vessels stiffen and the heart has to work harder. Circulation declines, increases the risk of clots, irregular heartbeats, and fainting. The QMA's responsibility is to help residents change positions slowly to prevent fainting, monitor vitals, report concerning symptoms, and observe for adverse effects of cardiac medications. Cardiovascular drugs include digoxin to strengthen the heartbeat, antiarrhythmics to correct rhythm, antihypertensives to reduce blood pressure, anticoagulants to prevent clots, and statins to lower cholesterol. There's also more medications in your textbook, so please review all of those medications. There's different types of blood pressure medications. It goes into beta blockers, ARBs, calcium channel blockers. There's also vasodilators like nitroglycerin that relieve angina. And you'll need to watch what to monitor for that, like hypotension. And then diuretics are also another one, and antiplatelets. So just review that in your textbook. The cardiovascular system is central to health. With age and poor habits, risks increase. Early detection and treatment matter. QMAs support residents by monitoring, educating, and assisting with care plans. Also, if you see anything that is out of the normal, we need to be reporting that to the nurse as soon as possible.